Hi, this is Ben, back with another important topic for NCLEX and nursing school exams. What is anxiety? Anxiety may be defined as apprehension, tension, or uneasiness that stems from the anticipation of danger, which may be internal or external. It is universal, communicable, not directly observable, and it can be studied through behavioral manifestations. Types of anxiety disorders that we are going to cover today are panic disorder, specific phobia, social phobia, agoraphobia, obsessive-compulsive disorder, and body dysmorphic disorder. Biological theories. Research shows there is a clear genetic susceptibility to or vulnerability, but more research is necessary. 20% clients with obsessive-compulsive disorders have first-degree relative with OCD. Neurological theory. Teach your clients that anxiety has biological roots. It is not a result of poor coping or failure. It is a disruption of the emotional processing center in the brain. Panic disorder. Panic disorder is an anxiety disorder characterized by unexpected and repeated episodes of intense fear accompanied by physical symptoms that may include chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. It is characterized by recurring panic attacks. Onset is unpredictable. Intense apprehension, fear, terror, and feelings of impending doom. Intense physical discomfort. Symptoms come on suddenly and unexpectedly. Panic attacks typically last 15 to 30 minutes, but can be longer. Client may experience persistent worry about when the next attack could occur. Nursing interventions during panic attack. Provide the safe environment and ensure the client's privacy during the attack. It's the first priority. Stay with the client. Help the client focus on deep breathing. And talk in a calm, soft, and reassuring voice. Nursing interventions after the panic attack. Teaching will include relaxation techniques. Encourage the client to speak about how he was feeling before, during and after the attack. And provide a structured environment for physical safety and predictability. Phobias. An illogical, intense, and persistent fear of a specific object or a social situation that causes extreme distress and interferes with normal functioning. It may or may not result from the past experiences. And the point that I want you to note is, adult client understands fear is unusual and irrational but feels powerless to stop. Let's discuss the types of phobias. First one is specific phobia. Specific phobia is a marked fear or anxiety about a specific object or situation. For example, animals, like fear of spiders, insects, or dogs. Natural environment, like fear of storms, heights, or water. Situational, fear of being in closed spaces, airplanes, or elevators. And situations that may lead to choking or vomiting. Social phobia. It is also known as social anxiety disorder. Social phobia is a type of anxiety disorder. People who have social phobia experience extreme and persistent anxiety associated with social or performance situations. Client fears they will act in a way that will cause humiliation and embarrassment. It leads to avoidance of social experiences. Agoraphobia. It is characterized by marked fear or anxiety about two or more of the following. Using public transportation. Being in open space, like parking lots, or bridges. Being in enclosed spaces, like movie theaters. Standing in line or being in a crowd. Being outside of the home alone. Agoraphobia is a fear of being in places or situations from which escape might be difficult or in which help might not be available if panic symptoms occur. The client will avoid places or situations that cause anxiety. Nursing interventions for phobias. Acknowledge the need to avoid the source of irrational fear. Assist the client with self-awareness. Stay with the client during heightened anxiety. Let them know they are safe with us. Do not force the client to confront the source of his fear. Promote independence and effective functioning in the environment. As future nurses, comprehending anxiety and phobias is vital for patient care. Be confident in your knowledge, as it's essential for the NCLEX and your nursing practice. Stay curious, stay compassionate, and best of luck on your exams.